Hi everyone, welcome back to my YouTube channel, and today we are going to talk about age changes in cementum. So let's start our topic with introduction. Cementum is a specialized calcified tissue covering the tooth root. It serves as attachment medium for periodontal ligament fibers and play a key role in maintaining tooth stability. Unlike enamel, cementum continues to form throughout the life, making it highly responsive to age and functional demands. Age-related changes in cementum are important in clinical dentistry, forensic odontology, and understanding periodontal disease progression. Structure and type of cementum. First, we will talk about basic concept. It has three components: inorganic content, organic matters, and cells. Inorganic content in cementum is 45 to 50%, that is primarily hydroxyapatite crystals. Organic matrix is 50 to 55%, that is mainly collagen fiber that include type 1 collagen fiber and type 3 collagen fiber along with proteoglycans and glycoproteins. Then there are cells in cellular cementum, that are cementocytes that are embedded in lacunae. Types of cementum include four types. First is acellular extrinsic fiber cementum, that is found near the cervical third, essential for root tooth attachment. Second is cellular intrinsic fiber cementum, that is located mainly near the apical third and it is involved in repair and adaptation. Third is cellular mixed fiber cementum that contain both extrinsic and intrinsic fiber. Fourth is intermediate cementum, as thin layer next to dentine at the cemento-enamel dentinal junction. Age-related changes in cementum. Cementum is unique because it continues to thicken with age, unlike many other dental tissues. The continuous deposition is influenced by occlusal forces, periodontal health, and biological aging. There are changes that are age-related that include structural changes, histological and microscopic changes, functional and mechanical changes, chemical changes, changes in cemento-dentinal junction. Now let's talk about these changes one by one. First changes are structural changes that include increase in cementum thickness, increase cellular cementum, and changes in cementum surface. Increase in cementum thickness. Cementum deposition continues slowly throughout the life. Apical region and furcation areas show the greatest increase in the thickness. Cervical cementum show minimal thickening, and deposition of secondary cementum occur even without functional stimuli. Then there are increased cellular cementum. As with aging, the proportion of cellular cementum increases, especially in apical region. Cementocytes become more numerous but may show signs of degeneration due to reduced nutrition. Then there are changes in cementum surface. As with time, the external surface of cementum becomes rougher due to repeated remodeling and resorption repair cycles. Sharpie's fiber become thicker and more mineralized. Second type of changes are histological and microscopic changes that include incremental line, mineralization changes, and cementocyte alteration. First, incremental line. Incremental line or restral line become more prominent with age in cementum. This spacing between lines tend to increase due to slower deposition rate. Second is mineralization changes. As cementum become more mineralized with age, hypermineralized area or cementum sclerosis may develop. Mineralization increases resistance to resorption but reduces flexibility. Third is cementocyte alteration. As lacunae become more irregular, canaliculi may decrease in number and length, reducing cellular communication. Some cementocyte may undergo atrophy or degeneration. Third changes are functional or mechanical changes that include reduced resorption and increased brittleness. Reduced resorption. Older cementum is less prone to resorption due to increased mineralization, and this is beneficial during orthodontic tooth movement as cementum protects tooth from excessive resorption. Second is increased brittleness. As with aging, cementum become harder and more brittle. This increases the risk of cracks during traumatic forces. Fourth changes are chemical changes that include fluoride uptake and changes in organic matrix. First is fluoride uptake. As cementum accumulates fluoride over time, similar to enamel, high fluoride increases resistance to caries and resorption. Second is changes in organic matrix. As organic components show signs of aging, including cross-linking of collagen fiber, degenerative changes may occur in matrix protein. Fifth type of changes is changes at cemento-dentinal junction that includes loss of dentine, this next cemento-dentinal junction, and fusion or ankylosis risk. Loss of distinct cementodentinal junction. With ages, cementodentinal junction become less distinct and more irregular. Mineral deposition may make the junction appear blurred. Second is fusion or ankylosis risk. Excess cementum deposition may contribute to area of fusion between cementum and alveolar bone, that especially in older individuals. Clinical implication of age-related changes. First is in forensic dentistry. Cementum thickness and incremental line help estimate age with good accuracy. Cementum annulation, that is continuous growth line, is widely used method. Second clinical application is periodontal consideration, as increased cementum thickness may reduce tooth sensitivity due to additional coverage over dentine. Age-related deterioration of cementosite may reduce repair capacity. Cementum resists periodontal breakdown but may show surface irregularities that harbor plaque. Third clinical implications are restorative and endodontic complications. There are thickened apical cementum that can complicate working length that determinations in the root canal treatment. Increased mineralization may affect root planning efficiency. Fourth clinical implication is occlusal and functional changes, as cementum deposition helps compensate for occlusal wear by moving the tooth slightly occlusally. Excessive cementum deposition may contribute to hypercementosis. Hypercementosis as age-related change. Definition: hypercementosis is excessive cementum deposition beyond normal physiological limits. Its causes include part of natural aging process, and chronic inflammation, occlusal trauma, or systemic conditions like pelagic disease may contribute. Consequences include bulbous root formation, difficulty in extraction due to enlarged root surfaces, and it is often asymptomatic and detected radiographically. Conclusion of this lecture video. Cementum undergoes continuous and predictable changes with age. These changes include increased thickness, elevated cellular content, enhanced mineralization, and more prominent incremental lines. While such modifications help maintain tooth stability and compensate for occlusal wear, they also have clinical implications in periodontal therapy, restorative dentistry, endodontics, and forensic science. Understanding these changes ensure more effective diagnosis and treatment of aging dentitions. And this was all about age changes in dentine. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.